Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, in the retinal detachment, in scleral buckling is done. So now, in the retinal detachment, we also use some vitreous substitutes. Vitreous substitutes which can be used for retinal detachment are air, SF6, perfluorocarbons like C3F8 and silicone. These are actually injected into the vitreous cavity. Okay, when they are injected into the vitreous cavity, this is the tear. If an air is injected into the vitreous cavity, this air will push this retina and repose the retina to its original position. Okay, so this is so with the help of these vitreous substitutes also we can treat the retinal detachment. So if you put a silicone oil in the eye, if you put a silicone oil for the retinal detachment, the silicone oil floats over the uh, aqueous vitreous humor actually, and thus this is actually called as reverse hypopyon. So this is the silicone oil in the anterior chamber. It looks like the hypopyon in a reverse side, so it is called as reverse hypopyon.
thank you and thank you for watching.